You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. We're talking in studio with Ohio's go-to implant dentist, Dr. Evan Pivetz. Dr. Pivetz, welcome to the program.
Pleasure to be here.
Now, I know you brought a stack of photos, so we'll
Yes.
get to as many of those as possible. Now, for people that don't know your practice, like who's the typical dental implant patient that you see?
Absolutely. So there's about two types of patients that come into our practice.
Okay.
The first type is a patient that's coming in that has been kind of riding that dental carousel, as I like to say. They've gone to their general dentist every 6 months, every year, and they're continuously told another root canal, another crown, another set of fillings, and maybe they have some gum disease, maybe they have teeth that are missing or failing, and so these people, they've just kind of been riding this carousel over and over, and they're looking for a way to get off. And at some level, those people are afraid they're going to end up in a denture. And for those people, what we can do is we can give them an upper and lower set of teeth that don't come out.
Supported by dental implants.
Supported by dental implants.
So no more dentures, by the way. We said that at the top of the show.
Yeah.
Is that realistic, whether it's 20 years or 40 years, like the future of dentistry? Dentures that we know them may not exist. They'll all be attached to something?
Yeah.
What are your thoughts on that?
So I think that dental implants are the way the future is going. We have better options than dentures for people.
Okay.
Dentures are uncomfortable. You have to take them out at night, put them in a cup by your bed. Dental implants offer something to patients that allow them to have teeth that don't come in and out and take away all those bad parts of dentures.
Now, I interrupted you. You were talking about the second group of patient, and the second group, is that the denture?
Yes,
wearer?
exactly. It's the patient that's currently wearing dentures. And you may not know this, but there's so many people out there who are currently wearing dentures. Yeah. So I looked at the stats right before I came in.
Okay.
So in Ohio, 15% of patients over 65 have no teeth. That means they're either wearing dentures
what's the
or
number
wearing
on
nothing.
that?
So what that means is, and this is just in Ohio, just over 65, there's over 400,000 people out there who don't have anything in there. What means is
no teeth, just a denture.
no teeth, just a denture. So
Okay.
you take those 400,000 people, you could fill the shoe at Ohio State multiple times over with all the people that are wearing dentures out there.
So if it's so good, right, getting upper and lower teeth that don't come out, why aren't they all doing it? Why aren't they all coming in and saying, I want to get this done?
So there's
What's your take?
There's a few reasons why people aren't coming in. The first reason is, people that are wearing dentures aren't going to the dentist that often. Someone who's wearing a denture, the only time they're coming in to see their dentist is when that denture's hurting or it's loose, maybe after years because they've had some bone loss that's causing that to happen. So they're not going to that dentist
So they don't know
very
their
often.
options?
They don't know their options. They don't know that there's a better option out there for them with their dentures. And I think the other reason that people aren't coming in is fear. So they've been going to the dentist for years before they had dentures. There was a root canal here, multiple crowns there, fillings here, maybe a trip to the periodontist, the endodontist. And so when they finally get those teeth out and are in that denture, they're relieved that they don't have to go to the dentist anymore. And for those people, day of the procedure, they're able to come in and walk out with a brand new set of teeth.
So walk in with no teeth.
Yes.
They walk out with upper and lower teeth that don't come out.
Exactly.
I mean, is that common or unusual that you're able to do that? Or?
Absolutely not. Almost every single patient that comes in is getting those teeth same day or next day. People don't have to worry about being in that denture any longer, because that day of the procedure is when we put those implants in. We're able to get them teeth almost immediately.
How old can you be? Like, what's the higher upper end range for somebody that wants to get new teeth?
So I don't think there's a limit. I had a patient a few months ago who was 92 who came in.
Why would a 92-year-old want to do this?
I think that a 92-year-old, just like anyone else, wants to eat and chew, wants to smile.
Okay, that's fair.
Yeah, so
especially probably if you're older.
Yeah, absolutely.
They're not more likely to fall out. I mean, if you're 92 years old.
No.
These implants?
Absolutely not. So for her, she was wearing dentures for the past 3 years. She kept her teeth for a very long time. But then once she got those dentures, she was losing weight. She didn't want to go out with her family anymore because she felt like those dentures couldn't stay in. She was self-conscious about it. So she came to us because she was looking for something better. And who cares if you're 92? She wants to enjoy that time that she has with her family. So she came in, got implants on there. She has teeth now that stay in. She doesn't have to worry about them coming out while she's at dinner with her family. She's able to eat, and she's not worried about losing weight. It's any age, it can benefit you.
So when a 75-year-old is in your office and says, "Doc, I'm too old," that's not even close.
Not even close. I had someone just the other day who came in. He's had these teeth for about a year. He's 70, and he said, hopefully he has 20 more years. Why wouldn't he want to enjoy those 20 more years? He said, why did it take him so long to do this? And he said he was telling his brother, he was telling his friends, they should do it because he wanted to enjoy that time. And he's like, why did he wait so long and spend so much time?
Do they all have regrets like that? Like everybody, because you have a stack of photos over there
Absolutely.
that have all been through this.
I think most people think to themselves afterwards, what took them so long? And it goes back to that fear. People are afraid. People maybe don't know it's an option, but once they get those implants, once they get teeth that don't come in and out, they're going, why didn't I do this sooner? Why didn't I enjoy life this way sooner?
But you mentioned somebody in a denture like 30 years, but isn't it true that if you've been wearing a denture like 20, 30 years, you can't do this, you don't have enough bone?
Absolutely not. Maybe back in the old days or at some practices, you might not have enough bone.
Meaning it's based on experience of the doctor?
Absolutely.
Okay.
So with the technology we have, with the implants that we're able to place, if you're healthy enough to walk into our office, you're most likely have enough bone and healthy enough.
Now you brought photos.
Absolutely.
What are we looking at?
So this is one of my patients here. So he came in, no back teeth. You can see on the dark spots there on the sides of his mouth. So if you don't have any back teeth, you can't chew anything. He's coming in because he wasn't able to chew. When he smiles, you can see those spaces. He's looking for something, an option that's not a denture. And I think people don't want to go into that denture if they don't have to. So he came to us to find other options.
So they do a lot of research before they get to you?
I think people research and people find us and they come in and they see that this is kind of all we do.
Okay.
We take care of people like him.
So what were his options?
So his options were, with the state his teeth was in, it was a denture or it was implants to support brand new teeth.
Okay, good.
Yeah. And so this is his after here.
This is nice.
So look at that. Big smile.
It looks good.
You can see he's got back teeth there. He's able to chew. He's able to smile. And he's not worried about those spaces. He's not worried about missing those teeth in the back. And Randy, in that after photo, wouldn't you say he looks younger?
He does.
Yeah,
that's for sure.
Look at that smile. Look at how it follows the lip line.
Like the teeth kind of fit perfectly in there.
Absolutely. That wasn't by accident. It's by design. We design these cases to the patient, make teeth that fit them. And he looks great, and he's smiling all the time now. And look at this. So this is him the last time he was in.
Right.
Look at that smile. He's happy. He's excited. He finally got new teeth and is able to walk around and smile and chew and eat whatever he wants.
What's it like when they look at the mirror for the first time?
It's always a big reaction. So when they first get those teeth, it's always that you get the happy tears, you get the family that sees it, and they get those happy tears. But Randy, what excites me, what really makes this important to me is when they come in a year later and I ask them, what have you been up to? And they tell me, I went on vacation. I was able to go to Europe or Mexico. I went to Italy and I was able to eat pasta with my spouse. I was able to drink wine. Maybe it's a new job or a new girlfriend. It's this transformative experience that goes beyond just a smile, and it completely changed their life. And then you got to see this next patient, Randy.
Okay.
So this is our before photo here. And so she didn't like that she was showing so much gums in her smile. She was missing teeth, as you can see. She just was ready for a complete change. And because of the state her teeth was in, because of the gum disease, the bacterial infection, her options were a denture or implants that support teeth.
Okay.
So take a look at this after photo here. Look how big that smile is. You would almost not even think that's the same person.
That's
if
true.
You saw those two people. She's happy. She's excited. She couldn't stop smiling that day when we got her teeth.
She does look younger.
She does look younger,
Almost
yeah.
like it could be the younger sister of the before.
Yeah, those two photos, you wouldn't believe that that's the same person. So here's her that same day. Look at that smile. She's so excited to finally be able to do it. And you wouldn't believe it's the same person if she wasn't wearing the same shirt in all three photos. And I take those photos, me and them, because they smile more naturally when you have just a cell phone taking a photo, just like you would at any family event. Sometimes when you're in that dental photo booth getting those photos, it's hard to get people to do that natural smile, but you can see it there when we take that photo together.
You said on the before photos, some of these patients don't even want to smile. Like you have to talk them into smiling.
We have to coach people to get smile big enough that we can actually see. Most people are so used to hiding that smile that when you ask them to smile when we're taking photos, they don't know how to.
Now, this seems like a painful procedure.
Believe it or not, it's not as painful as you would think.
Okay.
So they're numbed up for the entire procedure. So
they don't feel it.
They don't feel it at all. And then majority of people are getting IV sedation during that procedure. So they're calm and comfortable. They don't have much memory of that procedure after they're done. Most people go home and rest that night, and the next day they're taking over-the-counter pain meds.
You say they have like amnesia.
Yes.
Almost.
Yes.
About the procedure.
Most people can't remember what I was telling them afterwards. So
who does the sedation? This IV sedation?
Yeah.
And what's monitored and how safe is it?
Yeah. So I'm doing the IV sedation, but I always have someone else, a nurse there, and their whole job is to watch that monitor and make sure that patient's safe. So
okay, good.
IV sedation is actually safer than most other sedations because we have them on monitors. We're constantly seeing all their vital signs, and we have someone there whose sole job is to watch that patient and make sure they're comfortable.
That's very nice.
Let me show you this next patient.
All right.
So this is her before photo. So she was wearing a partial denture on top, but she was keeping it all the time because she was afraid of people seeing her with her missing teeth. She was hiding it. But with a partial denture like that, you're not able to eat the same as teeth that are attached.
Like you can't bite into
things
with your front teeth.
You have to worry about that.
Okay.
So she was very self-conscious about that, very self-conscious about the teeth not matching, being different colors. And with her problem was her upper teeth. So we got her an upper set of teeth on implants that don't come in and out, because her other option would have been a denture, and she was not having a denture up there on top.
Let's take a look. Is that her over there?
Yes, this is her. So look.
That's a good looking smile. I'm trying not to side with you, but these look good.
Look how good that smile is. Look how much younger she looks.
Yes.
It's almost impressive how much more she was smiling, how much bigger that smile was between those two photos, because she was so used to hiding that smile because she didn't want people to see that partial denture. She looks younger. She looks more animated, more happy all the time.
You know, like when I was talking to you on the phone, I always feel like it's an exaggeration that, you know, they look better, they look more educated, more sophisticated, but all of those things, as you were showing me this, it's true.
Absolutely, yeah.
It gives them a different look.
Yeah. So here's same thing. Here's her, me and her. Look at that beautiful smile. She's excited.
Looking good.
She could not wait to go home and show her sons her new smile. And so here's this next one, Randy.
All right.
So he came in.
He looks like he has pretty good teeth.
Yeah, he was missing a good amount of back teeth. He had some gum infection, some gum disease in there. And he was in a little bit of pain. He didn't want to do more dental work. He felt like he kept getting dental work done and things weren't getting better. And he just wanted to have that beautiful smile. He wanted to be able to eat what he wanted without constantly having to worry about going back to the dentist every 6 months.
So this was upper and lower teeth that were bad?
Yes.
You call them they're failing?
Yes. So those teeth were failing. His options were pretty limited. He was looking at either a denture or he was looking at implants that supported brand new teeth.
Okay.
And here's him afterwards. So sometimes right when they get those teeth, it's the same thing. They have trouble getting that big smile because they're not used to smiling anymore. But he told me he came in after these were done, and I asked him how things had been, and he does these really long bike rides, right? 100-mile bike rides. It's what he loves to do. And he said the last one he went to, people didn't say, oh, it looks like your teeth are better. They were telling him, oh, you look happier. Oh, something's different. You look excited. Right? Yeah. People didn't immediately notice that it was the teeth, but they just noticed he seemed more energetic and happy.
What do they like more when it's all done? What their teeth look like or what they could eat?
It's a little bit of both. Initially, it's that new smile that they're seeing. That's the most exciting part. But as time goes on, they see all the other things that come along with it, what they can eat, what they don't have to worry about anymore. All that stuff kind of comes later, and they realize as time goes on.
And you just take care of them like regular teeth. You go to the dentist a couple times a year, get them cleaned.
Yep, you come back, you get them cleaned, get them looked at, get your regular dental x-rays. You treat them just like you used to treat your normal teeth. You're just coming back to see me and make sure everything looks good.
Now, because of the gum infection, you said there's like some bad breath associated with that. How soon does that go away?
Almost immediately. So when you're cleaning out that gum disease, you're cleaning out all that bad bacteria that's causing that bad breath. So when we get all that out and put those implants in, it's almost an immediate change on breath, on all that stuff that kind of comes along with that gum disease.
So with this gum disease, this bacterial infection, so like anything else, and I'm asking you, your body has to fight this infection. Are you finding that when you remove this infection, people have more energy, or they feel healthier?
Yeah, so your immune system is constantly running when you have gum infection in there. You imagine your body is constantly trying to fight against all that bacteria that's in there. So when you remove that, you're not having to constantly feel sick all the time. People are healthier. People feel like they have more energy.
So by definition, they're healthier.
Absolutely. You don't have an active disease in there. Again, I have to show you this one. So this is me and him, same day. But when you take that photo, me and him, you just see that natural smile. He's happy, he's excited. He was so happy to get those teeth in.
Did they ever call you and say, can I eat now? Or are they like worried to make that big step into something crunchy or chewy or whatever?
I think people take it at their own pace. Some people say that night they're going to go get a big steak, and other people kind of take their time getting used to it. They're not sure whether to trust those teeth.
A steak?
Absolutely, yeah.
Really? But you tell them to take it easy though, right? Or no?
So once they get that final set of teeth,
okay.
Once we screw in that zirconia, which is that super strong material that we make those teeth out of, they can go eat what they want.
Eat whatever they want.
Yeah.
And they do.
Do
they gain weight or do they lose weight?
Hopefully they're gaining weight. Hopefully that they're able to eat and enjoy anything they want.
Okay, good. Now, what about like chewy things like, let's say like, or popcorn, or like beef jerky? What are your thoughts on that? Could they do that?
Absolutely. So we're giving them teeth that are super strong, that are able to chew, have back teeth in there, whatever they want to try to eat. So let me show you this next patient.
All right.
So this is his before. You know, he had some problems. He's obviously hiding his smile there, but he was coming in. He had recently retired, and he decided it was time to do something for himself. He had been kind of avoiding coming to the dentist for a while, but he had some teeth that were failing. He had some of that same gum disease that we've been talking about, top and bottom, and he was looking for solutions. And his options would have been a denture or new teeth on implants. And he wasn't going to go with a denture, so we did those new teeth with implants.
Now, do you ever get excited? Like, you're hearing their hard luck story, right? Everybody's got a difficult time they've had with their teeth. But do you ever get excited going, boy, this is going to be good? Or they don't know how good this is going to be. Do you ever feel like that, like on a consult?
All the time. You see the potential of people, and the more you do this, the more you can see that end result before we even get there. So there's...
Now patients tell you, like, doctor, you've changed my life. Do you hear that?
I do hear that. But Randy, really, these patients are changing their own lives. So that first step to come in to see us, that first step towards changing is such a big step for a lot of people. But once they've made that step, they're on the path already. So once they've made that hardest step to come in and see us, to see what their options are, that's when the world opens up to them.
Is that right? Now, you know, we joked in the green room that the most expensive part about this is going out to eat all the time. Is there some truth to that?
Yeah, I mean, going out to eat, traveling more. You want to go
traveling more?
You want to go try food from different countries because you can eat it now.
Do you hear those stories?
Oh yeah, all the time. So, you know, a lot of these patients are retired or close to retiring, and they want to enjoy that time for themselves. So,
I got to ask you about the snap in, snap out. I haven't heard you talk about it at all today. But I know that you told me on the phone that you're not a fan of snap-in teeth. Why is that? Why don't you like them?
So I don't like them because patients don't like them. It's much better than a denture. So if you're getting 2 snaps or 4 snaps down on those lower dentures, it's going to hold that denture in way better than a loose-fitting denture.
Okay.
But at the end of the day, it is still a denture. You're still having some similar problems that a denture had. And getting those 4 to 6 implants with the teeth that don't come in and out is such a big upgrade.
You say there's a lot of maintenance with these snap-ins.
Yes.
What do you mean by that?
So those snap-ins have components that need to be changed out. You gotta regularly come in and get things adjusted or changed. So it's just a lot more maintenance, a lot more work on the patient to still have to take it in and out at night. We'll do them if someone needs them, but really I think that the gold standard is the teeth that don't come in and out.
Now, in the long run, is it less expensive to get upper and lower teeth that don't come out because of the absence of out-of-pocket expense to get these adjusted all the time?
I think in the long run it would be. What I want patients to know is that, with those snap-ins, snap-outs, there's still a denture, and dentures have a lifespan to them. So, they might need a new denture in 5 to 10 years, and that's normal because it's still just a denture. So back to Greg. So let me tell you what we did to him. We did a upper and lower set of teeth on implants that don't come in and out.
Okay.
And so this
And
is
it's a full arch of teeth we're talking
It's
about,
a full
right?
arch of teeth. You get all the way back
And
to those chewing
4 or
teeth.
6 implants? Is
4
that
to 6
correct?
implants, yes.
Okay.
So this is Greg now. So
That's looking good.
look at that beautiful smile. He joked with us when he first saw that. He said he was going to be beating ladies off with a stick.
Okay.
Yeah. So he's smiling. He's enjoying his retirement. And that was the reason he did this. He said he wanted to enjoy that time for himself. And he's happy. He's excited. And this is us right after he got those teeth in. He said he was immediately going to go try to see what he could eat with those. Put them to the test.
And so, like, after they get their permanent teeth, they'll go out that night and eat.
Absolutely, yeah. I tell patients, hey, go to the nicest Cameron Mitchell steakhouse that is close to you and try to eat what you can. Let me show you this next patient.
All right.
So he came in. This is one of those patients where his wife had to drag him in. He's a contractor. He wasn't going to come in until he absolutely had to, but
That's most men, right? We put it off?
Yes, most men will try to put it off as long as possible. But he came in because he had gum disease. He had teeth that were falling out or had fallen out, top and bottom, and he was looking at his options.
Now, is this true? I mean, if you have this gum infection, you can't brush and floss it out.
Yeah, so
no matter how much they brush and floss.
How much you brush, how much you floss, it's still going to be there. It's down under those teeth. Your gums are going to bleed every time you're trying to do that. There's sometimes just no way to fix that.
So his option would have been a denture. What did you do for him?
So we did upper and lower teeth on implants that don't come in and out. He didn't want a denture. He's talking to people all day long. He didn't want to have to worry about that denture coming out at the wrong time. So this is him now. He's still getting used to smiling, but beautiful set of teeth. He was so happy. He almost danced out of the office when we first showed him that. It
looks good.
And then here's him actually, smiling a little bit more with me, taking that photo. He was so happy to get those teeth in. He said he was going to go on a date with his wife that night, get a steak or something like that. All right, so here's this next patient. So he came in, because his teeth were hurting. He had been putting this off a long time. He had gum disease in there, bacterial infection, and he was just looking for options. He was tired of going to the dentist and constantly being told, you need X, Y, Z all the time. So he was looking at what he could do. And his options when he came to us were a denture or implants with teeth that are attached to those.
All right, let's take a look.
Here's him after. So this photo was actually taken.
Looks younger, actually.
He looks younger. That was taken a year after he had his teeth. He came back in to see us. We took this a year. I asked him, I said, what have you enjoyed about this so far? What's new? And he said he's been telling everyone. He's been telling his brother, his friends, that
all of his friends with bad teeth.
All his friends with bad teeth, why not do it? He said he's got 20 years left. He wants to enjoy them. And he's like, why didn't I do it sooner? It's one of the best things that's happened to him. He loves his new teeth. And he's now an advocate trying to get other people to do it. And this is him, same day, getting that nice big smile.
Looking good.
He was so excited, and we were so happy that he enjoyed it so much he was telling other people to come in and get him.
And so no restrictions on eating, none of that.
No, he was actually one of the ones that said he was so excited that he could eat salad again.
Now people are driving to see you. Is that right?
Yes.
Like great distances.
We have patients who drive 6-7 hours. One of those patients I showed you drove from New Jersey to come see us.
I've got to ask you this. It's in my notes. And that is that how dental implants are typically done is you go to one doctor that does the surgery. Correct me if I'm wrong here. And then you go to another doctor where they put the teeth on top. You do both parts. Is that why you do it so quickly?
Yep. So what we do is we are able to do everything in one place. We're able to print the teeth in the next room for the patient.
You have like a digital printer
Yes,
that prints
we have
the teeth?
a 3D printer that prints the teeth for the patient. So what they're doing is they're getting everything done by us. They're not having to jump from office to office, from provider to provider. We're able to control their care the whole time. We're able to craft that smile completely throughout the whole process. So we're streamlining that process for the patient.
And does it cut cost a little bit?
It does, yeah. So if you're having to pay X doctor and Y doctor to get stuff done, sometimes it's 3 different doctors, one to do the surgery, one to do the teeth, and one to take care of it. So if you're able to get all that done in one place,
doctor, one fee.
it cuts the cost.
So when they research, that's probably one of the things that they like about what you're doing?
Yeah, they don't want to have to hop from office to office. They want to have one place that they can call home and get everything taken care of.
Now, I got to ask you this because insurance doesn't really cover it. Even the best dental insurance, Medicare, Medicaid doesn't cover it.
Well, people are financing this. So dental insurance maximum gives you $1,000 to $2,000 a year. Medicaid and Medicare don't cover this procedure. So what people do is they finance this, and we have companies.
You set it up? I mean, you set it up for them?
We have companies that specialize in financing this procedure.
Okay.
And people are able to finance it and make it affordable for them.
You have to have okay credit, though.
Yes.
To get that done. Is that
yeah,
correct?
you have to have okay credit.
Can they get a cosigner?
Yep, they can get a cosigner. We've helped people, and I can tell you, Randy, that 8 out of 10 patients are financing this, and that's not just my office, that's across the country.
They're doing it across the country.
Absolutely.
So no more dentures.
No more dentures.
You think you could wipe out dentures in Ohio?
I'm hoping.
So there's really that many people.
Yeah.
And it's just the fear of the dentist, not knowing what's available. And you say when it's all done, the next day they could take over-the-counter, like pain meds, or you can prescribe something.
Absolutely. Most people don't have that much pain after this procedure.
Okay.
It sounds like it would be painful, but most people come back and they're surprised by how little pain they're in.
So they worried for nothing.
Yes.
Is that right?
Yes.
And so you offer all levels of sedation.
We do, yes.
You do it right there. Now, if somebody wants to make an appointment with you, do you prefer they go online or just call your office?
They can do either.
Okay.
If they call our office, someone will be there to help them schedule an appointment. And if they make an appointment online, we'll reach out to them.
So we're out of time. So for the 2 groups of patients that you described, one has teeth, but those have to come out, and they don't want a denture, or the current denture wearers. They've watched this, maybe they've heard what you have to say, but for whatever reason, they're still scared, skeptical, or whatever. What do you say to them?
I would say anyone that's currently wearing a denture or is afraid they might have to wear a denture, call us, come see us, see what your options are.
Just start with the options.
Start
Free
with the options.
consultation?
Free consultation.
And they get to meet you on most of these appointments?
Yep, they get to meet me. They get to meet my team. We're going to take free x-rays for them. We're going to make sure they're taken care of and see what options they have.
Now, you have big goals. I mean, you want to be like the premier, the go-to center in Ohio.
Yes.
For implant dentistry. Is that right?
I want to help as many people as possible get out of their dentures and into something that's better.
Okay, good. I want to thank you for coming to the show. Good stuff.
Thank you.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.